Good afternoon, everybody. I hope you have some energy for the leftover 2 presentations for today. So, I would like to present the National Biosafety Laboratory. The National Biosafety Laboratory is part of the National Center for Public Health and Pharmacy, which has an oversight body. It's a governmental institute, and our oversight body is the Ministry of Interior. We have lots of rules and legislation we have to apply and comply with it. As a governmental institute, we have 2 different roles. One of them is the authority role with different declaration, codification. We are leading a lot of public health programs. We have supervision of health cares, and we are connected to the health administration. We have oversight on the different epidemiological laboratory, health licensing, and innovation technology. And as the latest one, as we merge with the Pharmaceutical Institute, so we have a pharmacovigilance and medical licensing authority roles also. But we are not only authority, so the laboratory side also is represented in the institute, not only with the microbiological part, but you already heard a very good presentation today earlier about the environmental health, but we have also occupational health, radiological health laboratories. Our laboratory, the National Biosafety Laboratory, belongs to the division of microbiological reference laboratories. The microbiological reference laboratory division contains more than 80% of the reference laboratory in Hungary. The division has 3 different departments, mainly if we want to categorize them: the bacteriological, parasitology, and mycology department, the department of virology, and the National Biosafety Laboratory is connected together them on the side of the highly pathogenic agent, because it contains also bacteriological and virological reference laboratories. As we are a governmental institute, as I already said, we have different legislation, why we are working, what we are working, and why should we work on those levels. One of the major legislation is the Decree of 18. I think everybody knows that we want to prevent the epidemics. This law is about the prevention of infectious disease and epidemics in Hungary. And this determines the laboratory diagnostic test that we have to carry it out, and everybody where and how should we carry it out. We have also laws on the protection of health workers exposed to the biological agents. We had already had a very good presentation from Dora, which was, thank you very much, that was a very good intro for this. And we have also legislation for human and technological requirements for microbiological laboratory, but National Biosafety Laboratory is also a GMO4 appointed laboratory, so we have to also comply with the GMO requirements. Besides this, we appointed as a critical infrastructure designated to this role for both of the National Biosafety Laboratory and also the microbiological reference laboratory part of the country. So it's basically of the resilience of the Hungarian infrastructures. So we have to also comply of these rules. But we are not only working on national level, we are part of many international systems, and one of this is the IHR, International Health Regulation. It's an EC regulation on serious cross-border threats, and in the frame of this, we have a 24/7 emergency contact center, and also our laboratories are part of the ECDC laboratory system. Besides this, we have some other rules, but I don't want to bore everybody all the rules and legislation we have to apply. Based on the regulations, the National Biosafety Laboratory has also a lot of duty, not only on the governmental system, on the research system, from the national system, but also on the international system. I just want to summarize here those ones, but later on I will present in detail on the different presentations. One of these, the National Biosafety Laboratory is appointed as a poliovirus essential facility. As already we had a presentation today earlier about the poliovirus environmental surveillance. What is behind this? The WHO want to eradicate the poliovirus, and they build up a strategy. And the core document for this strategy is the GAP4, the Global Action Plan for Poliovirus Containment. And this regulation are describing how do you have to apply, how do you have to comply with all these requirements. Beside the EFP surveillance and beside the environmental surveillance, there is also a lot of biorisk requirements. Based on our appointment that was from the Ministry of Health in 2015, we have to collect all the information about the poliovirus materials in Hungary, and we have to also collect all the poliovirus materials, which now can be only stored in the National Biosafety Laboratory, as the goal of the eradication is that has to be stored all the poliovirus on the highest level and the maximum containment level, which is the BSL-4. Based on this, we now are storing all the collected material from all the Hungary in the National Biosafety Laboratory, and we were certified by the WHO in 2023, and we got the Poliovirus Essential Facility interim certificate, and since that we have a yearly audit, and now we are appointing for the final certificate. As I already said, the core document of this Global Action Plan is the GAP4, which is basically complying with the ISO 35001. That has 14 elements, which in the biorisk management system we already had it, because the National Reference Laboratory System has to be worked on different ISO levels, has to comply with the ISO levels, and has to be accredited. So from the beginning of the reference laboratory system, the National Biosafety was part of this quality management system, so we don't have to build up a new one system, because at the beginning of the reference laboratory, when they started to work for several years ago, all the work with the microbiomes, with the pathogens, was based on the risk assessment, on the biosafety risk assessment. So what we only have to do was just pointing the poliovirus specification into our quality management, biorisk management system. Specifically on this was the work health program, because there were here some of the theses that we were previously not appointed in our laboratory, because in Hungary we have a very high vaccine coverage. But as in the GAP4 already we have to implement a vaccination policy based on the risk assessment for all the persons who have any access to the poliovirus or possible poliovirus containing material. Therefore, not only the part of the National Biosafety Laboratory, the colleagues of the laboratory, but also who are working on the environmental side, and they are leading the environmental surveillance, they have to also comply with requirements, so we have to involve them. And yes, I totally understand they were not so happy for it, because it means yearly vaccination and yearly testing of the sera for virus neutralization. And also, there was also some biosecurity rules. Now we have to collect all the poliovirus material that contains not only the living material, but also the RNA of the virus, and we have a restricted access to the materials, all the materials, and also we have to manage the different medical emergencies, as the poliovirus have a special requirements in case of any outbreaks, and now also all the people who is working with the poliovirus already had to the different, not only if they have any fever or like this, because in the biosafety laboratory and also microbiological side, it's really recommended if you are working with pathogens, if you are sick, you have to report also for the head of the department or for your worker program leader. But here we have to also apply the rules for the polioviruses. Regarding the competence and training, we already had in our biorisk management system, the competence and training program not only for the biosafety laboratory, but also for the reference laboratory division. So we have to just put a poliovirus-specific training and procedures, we have to add it to the catalog. And on the waste management and decontamination, we already have that waste management was covered for different highly pathogenic bacteria, viruses, but now we have to also just covering all of this for the poliovirus, which means we have to not only just apply, but we have to also investigate that our decontamination system process is killing totally the poliovirus. So that was that with the environmental health laboratory, we just tested together how we mimicked with enteroviruses, the poliovirus, how it's killing in our decontamination system. But we also added to the specific poliovirus section for the accident and the incident investigation. Long years ago, so in the European Reference Laboratory, 5 years ago, started just to reorganize the European microbiological reference laboratory system. Previously was a different project, like the SHARP, Aquadevel, or IMERGE project. There was EU-based project who was involved, all the European reference laboratory who worked with highly pathogenic agents. That they stopped this program, and now the ECDC established the European-based reference laboratory system. And last year, the NNGYK National Biosafety Laboratory with the Folkhälsoinstitutet from Sweden and the Institute Spallanzani from Rome and with the Institute Pasteur from France, we were appointed as a consortium together to the reference laboratory for public health on emergent and rodent-borne and zoonotic viral pathogens. In frame of this work, we not only have to providing services, diagnostic services, but also we have to providing training and organizing and delivering workshops and webinars. But we need to have them on the different research projects. We have to participate in regional and international projects and initiatives also. And we have to also build up surveillance, not only in Hungary, but also in the whole Europe. Not only European, so not only the part of the EU of these reference laboratories, but we are also representative from the Western Balkan and the Turkey, so this reference laboratory is also responsible for them. Based on this, the reference laboratory consortium have to provide training on the field of biosafety and the biosecurity, such as DONOF and DONOF PPAs, entry and exit in high and maximum contained laboratories, working under different biosafety level conditions. It's not only for biosafety level 3 and 4, but also on biosafety level 2. It's based on the risk assessment of the diagnostics. But we also have to be working with and handling animals and also emerging situation. Besides this, so how do you work in a laboratory? We also have to provide trainings on the field of the diagnostic for the virology and the bacteriology, also from the classical methods, like from the isolation on cell culture, or on the bacteriological side, we were also already asked for training on the classical culture methods, but also on the molecular methods, serological methods, and different animal experiments. We have a very big training portfolio. We were trained at different EU and international laboratories from Rome, Bernard Institute, Pécs, Robert Koch Institute in Berlin, even in UK and Australia. But we are also trained lots of external users from the Bernard Institute, Institute Spallanzani, Friedrich Loeffler Institute. But we also, during the COVID pandemic, started to working together with several national research groups in cooperation with them, because they needed for the SARS-CoV-2 research or TBC research, a biosafety level 3 laboratory. So we expand our research program for them. We trained from the Eötvös Loránd University, from the Semmelweis University, and from the DPC and Korányi also several people. We're also providing for the high containment infectious disease units in the hospital trainings. Based on this, you can see that how many field of our research is going, and we have to provide services not only on national but also on international level. We are part of the European research infrastructure for highly pathogenic agents, but not only for in the frame of the ERINHA, but also outside of the ERINHA, we have a lot of international collaborations. In the frame of the biosafety, how can we protect our peoples? How can we protect the population? We have led it in the frame of the F180 project during the SARS-CoV-2 pandemic. That was a very successful project. We had a research site and the vaccine efficacy data. We already isolated the viruses and provided for the government different data. There was also an antiviral research site and hospital treatments and evaluation site. What we have been done in the National Biosafety Laboratory, we characterized the SARS-CoV-2 virus for the different variants together with the Somerville University on atomic force microscope. We tested different rapid tests for the sensitivity and the specificity, so we could provide information for the government, for the public procurement. We also made in vivo and in vitro assessment for the different variants that they can have a much more oversight which variants could be more specific to the upper or the lower respiratory system. And since the beginning of the pandemic, we already sequenced more than 30,000 whole genome of the virus. And we also conducted an antiviral research with the ALT together. But not only in SARS-CoV-2, we have also on a surveillance program for highly pathogenic agents, such as the Crimean Congo hemorrhagic fever. Crimean Congo hemorrhagic fever is expanding to the north due to the climate changes, and we try to have it in the One Health frame, a complex answer to give, are we in danger or not? So in the frame of the CCHF surveillance, we tested human blood donors and also large farm animals, and we found 12 seropositive donors from the human and 11 reactive sample for cattle and sheep on the NAT3 regions. The screening was done with our immunofluorescence slide and also with ELISA. But we are working not only for the CCHF as a part of our work in the same context of biosafety. If you want to just making some study on the Nipah virus, then you first, all the virus that is comply, that you have to first understand the virus. We had a very good collaboration with the INSERM, and we studied the Nipah virus infection in different knockout mice, just to how it's controlling the Nipah virus of the infection. We could, in different knockout mice, just some of the elements recognize of the STAT-YAC immune pathway, and based on this, further development could be done for the antiviral testing, which we already done. We tested more than 1,000 compounds with 3C, ALTA, and the University of Oxford. But one part of our work is the animal work. We are usually conducting challenge studies in the laboratory, and one of these was the proof of concept study with University of Tokyo. They had a measles-based Nipah virus vaccine, which is founded by the CEPI, and now it's with the SCARDA. And we finished just yet the third round of the challenge study, and it seems that give a very high level of protection, and it will be going now to the phase 1 and phase 2 in the human clinical studies. But as already said, not only on the national level, but on international level, we have a role. Based on the IHR and the BTVC, the Biological and Toxin Weapon Convention, they have a designated laboratory network. This is the UNSGM network. This has the role, the prevent and the identification of deliberate events for all the pathogen, not only the highly pathogenic agents. And this designated laboratory network is mainly focusing on the disease X, the known and unknown agents from synthetic or natural origins. In frame of this, we have a lot of yearly 3 or 4 different EQAs. We have to comply with them, and different from different sample types, not only from human samples, also for environmental samples, animal samples, plant samples. We have to not only identify the pathogen, but also the contaminants of the samples, also what type of samples was. So we have to say that what kind of animal was, and we have to also identify the peculiarities and irregularities. Just we can make a risk assessment on the phenotype base that will be much more harmful. It's originating from a virus, or it's originating from a vaccine or a vector-based vaccine. So we are working not only with whole genome sequencing method, but also we are working with custom databases and bioinformatic pipelines, but we also have to work with cultures and MALDI-TOF and BSS 3 and 4 isolation and cultures. So as I can say, the National Biosafety Laboratory portfolio, it's not only the diagnostic, but through the research we are much more higher, we can provide much more higher level diagnostic and also prevention for both the Hungarian and the international population. Thank you very much for your attention.